When you hear about major heart surgery like a valve replacement, you probably think of older patients. But in the past few years, it's younger people in need of new heart valves, people under 40. Many of them are battling opioid addiction.
In Boston especially, we feel like we're taking care of a lot more cases of infective endocarditis related to injection drug use.
Tufts Medical Center infectious disease doctor Elise Worcel says injection drug users are at a higher risk for endocarditis, a dangerous heart infection caused by bacteria.
Untreated, it's a fatal condition.
The bacteria can come from dirty needles or from skin infections common with injection drug users. It gets in the blood, flows to the heart, and sticks to the valves.
As the valve gets eaten away, the bacteria can get flicked off into different parts of the body. So one of the scariest parts about it is when it goes to the brain, it can cause a stroke.
This is the thing that's very mobile, moving back and forth. That should not be there.
Cardiac surgeon Dr. Kenneth Werner says in a case like this with bacteria growing on the valve, the patient likely delayed medical help and now needs emergency surgery.
A lot of these patients are in denial. There's a stigma attached to them showing up to an emergency room.
In 2013, only 8% of heart valve replacement patients at Tufts were under 40. Last year, 35% of the replacements were those younger patients.
Patients and their families have to recognize when they have a fever, they need to see a doctor as soon as possible.
Fever, difficulty breathing, low blood pressure, and night sweats, all symptoms there may be trouble. Caught early, the damage can be fixed. But addiction presents another problem.
Often they end up using again, and when they use drugs again, they're at risk for getting another infection of the valve. Well, if someone had their first valve, what do they get a second valve? And that's where the ethical question comes up.
For these doctors, the answer is yes.
They're young patients. A lot of these patients have children. They certainly have family that are devoted to them.
Tufts is now taking a more comprehensive approach with these patients, not only treating the heart condition, but also bringing in recovery specialists and other services to develop a plan to fight the addiction. In this region, the fastest increasing population of patients needing heart valve replacements is women younger than 34. Dr. Worcel says she's now looking at what factors might be putting that group at a higher risk of infection. Emily Reamer, WCVB News Center 5.